Welcome. Thanks for watching this dairy video brought to you by DAIREXNet. In this video, Dr. Pam Ruegg joins us to discuss selective dry cow therapy. If you'd like alerts on new articles, videos, and resources, be sure to check out the video description below to follow us on Facebook and Twitter or sign up for our newsletter. And don't forget to subscribe to our channel here on YouTube. Today's presenter, Dr. Ruegg, has been a professor and milk quality extension specialist at the University of Wisconsin-Madison for the last 19 years. She received her undergraduate degree in DVM from Michigan State University, spent a couple of years in mixed animal practice in Wisconsin, and then returned to academia to complete a residency and Master's of Preventive Veterinary Medicine from the University of California, Davis. Prior to joining University of Wisconsin-Madison, she had varied professional experiences, including private veterinary practice, academic positions, and corporate technical service. Dr. Ruegg is active in a number of industry organizations and is a past president of the National Mastitis Council. Her research and extension work is focused on developing programs that help farmers maintain healthy cows and improving milk quality and safety on dairy farms. In 2018, she will return to Michigan State University as chair of the Department of Animal Sciences.
So today I'll be spending the next 30 minutes or so discussing a really hot topic today, and that's the topic of deciding on how to either implement, and if you implement, how to evaluate the use of a selective dry cow therapy program. This topic is an amazingly hot topic today because of the scrutiny today of the use of antibiotics on dairy farms. And the use of antibiotics for dry cow therapy is probably one of the most controversial uses that we have on our dairy farms. So we're going to dig deep into that subject today. One of the reasons is that we look at dry cow therapy as we're discussing antibiotic usage on dairy farms is that almost all dairy farms in the United States use dry cow therapy. And it's simply part of a standard mastitis control program. In fact, the National Animal Health Monitoring Service in their surveys, which have been done in 2002, 2007, and 2014, typically track the proportion of herds that use dry cow therapy and also how many cows within those herds are actually administered the antibiotics. And what you'll see is that there's been very little reduction in the use of dry cow therapy on dairy farms during the periods that have been evaluated. If you look back to 2002, about 85% of herds used dry cow therapy in every quarter of every cow, and when we get out to 2014, the last survey, it had dropped to about 80%. So more than 80% of U.S. herds treat 100% of the cows that are dried off. So most farmers treat most of the cows, and very few of the farmers treat none of the cows. If you look down at this chart down here that I'm mousing over, you can see that approximately 10% of farms don't treat any cows. The other 10% of the farms are distributed amongst those that treat selectively, which is the subject that we're using today. And overall, in the last survey done in 2014, about 93% of all cows in the U.S. received dry cow therapy. Now, it wasn't always this way. The use of what we call blanket dry cow therapy programs, meaning every quarter of every cow that's dried off, were developed in the 1970s. And they were developed in the 1970s because during that era, when they went out and evaluated the percentage of cows that were infected at the end of their lactation, more than 50% of the cows in our dairy herds here in the U.S. were infected primarily with either Streptococcus agalactia or Staphylococcus aureus. So during the period of the 70s where dry cow therapy was really introduced and started being adopted, the emphasis was on reducing infections with strep ag and Staph aureus. And the people that were advocating the use of dry cow therapy during that period had massive debates amongst the researchers and clinicians about whether or not selective dry cow therapy would be a better way to use antibiotics or blanket dry cow therapy would be appropriate. And ultimately, there were a couple studies done that demonstrated that during that era, when so many cows were infected, the use of blanket dry cow therapy was the most economical and effective way to reduce this large prevalence of infected quarters. So what's changed today? Well, today, fewer cows are infected at the end of lactation, and the type of pathogens or bacteria that are causing the infections have also changed. So what we're seeing today is a re-examination of the use of antibiotics on dairy farms, and the use of antibiotics for dry cow therapy is one of the most popular topics. Now, we're able to come to this re-examination of the use of antibiotics for dry cow therapy because we've actually done a really good job in controlling contagious pathogens. This chart that you can see on your screen is a study that we published almost 15 years ago. And in this study, we took bacteria from more than 77,000 milk samples that had been submitted to the Wisconsin Veterinary Diagnostic Laboratory over a 7-year period between 1994 and 2001. And in this chart, I'm just showing you the large reduction we had in isolation of our most typical pathogens. For example, in 1994, about 18% of all the milk samples had Staph aureus. And by 2001, that was almost in half. It was down to about 10%. Even better progress was shown for strep ag. In 1994, about 8 or 9% of the milk samples coming into the diagnostic lab contained Streptococcus agalactiae, and that was down to about 3% by 2001. Now, I haven't replicated this data recently, but my guess is the Staph aureus has continued to decline, and it's probably down around 5 or 6%. And strep ag, it's probably less than 1%. So we've had great success in controlling Staph aureus and Streptococcus agalactiae, and that success has come because we've had so much adoption of the 5-point mastitis control plan and the use of blanket dry cow therapy. So we've been successful with adoption of these best management practices, but we haven't completely eradicated mastitis. Today we've had a shift away from some of the more common types of mastitis, Staph aureus and strep ag, into mastitis being caused by environmental pathogens that tend to cause more clinical cases. That control, that successful control of these pathogens such as Staph aureus, strep ag, and other streptococci has been seen when we look at bulk tank somatic cell count data for U.S. herds. Between the period of about 1995 and 2015, the bulk tank somatic cell count for U.S. dairy herds has dropped more than 100,000 cells. And today, on average in the U.S., it's down to about 200,000 cells per mil. Now, these improvements in our mastitis, subclinical mastitis situation have resulted in people saying, hey, we've gotten a lot better at controlling the pathogens that dry cow therapy was really designed to help us with. Do we still need to use it in every quarter of every cow? Now, to answer that question, we have to think about why we use dry cow therapy. So remember that the purpose of dry cow therapy is simply to reduce the risk of mastitis. And the way that we do that is we look at both therapy and prevention. So dry cow therapy has two purposes. One purpose is therapeutic. So this is the use of dry cow therapy to cure cows that have subclinically infected quarters at the end of their lactation. Now, typically in the U.S., we don't use antibiotics to treat subclinically infected cows while they're milking. We wait to treat those infections until dry off. So for the therapeutic purpose of dry cow therapy, our question is, if we want to just treat the cows that are infected, do we have a good way to identify the cows that don't need to receive that antibiotic treatment? And can we just give the antibiotic to cows that are infected? So that's the therapeutic purpose of dry cow therapy. The second reason for dry cow therapy is preventive, and that is we've got this really high-risk period immediately after the cows dry off. That period is high risk because we're leaving milk in the udder. Milk's a great nutrient source for bacteria, so they can grow rapidly there. And we also stop doing a lot of the preventive practices that we do during milking that reduce the risk. Things like pre- and post-milking teat dipping, washing the udder, flushing milk out during the milking process. When we stop doing those things, we increase the risk that an exposure will result in an infection. So when we think about not giving dry cow therapy to every quarter of every cow, we have to think about, can we use non-antibiotic tools to protect these animals rather than using these precious antibiotics? Now let's talk a little bit about the therapeutic function first. When we think about the therapeutic function, we have to figure out a way to identify cows that have subclinical mastitis. And the way we do that is that we look at the cow's monthly somatic cell count value. It's pretty uniformly recognized that for clinical practice, having a somatic cell count greater than 200,000 cells per ml is evidence of an intramammary infection causing mastitis. That's a very solid threshold and very good evidence that we've got ongoing inflammation secondary to the intramammary infection. And the reason we're confident on that is that the somatic cell count of a healthy cow will not increase just because the cow is going through lactation. The reason cell counts go up is because we've got infections. When we take a look at the somatic cell count of cows throughout lactation, what we find is many herds have more than 30% of cows that have subclinical infections. This chart I'm showing on this slide is real data from just one Wisconsin dairy herd. This Wisconsin dairy herd is a really high-performing herd. They have high production, healthy cows, and their bulk tank cell count is only 160,000 cells per ml. On the vertical axis, you can see the percent of cows that have somatic cell count greater than 200,000 cells per ml. And the blue bars are for first lactation cows, the red bars are second lactation, and the greenish yellow bars are for third lactation cows. You can see that by the time you get greater than 250 days in milk, approximately almost 50% of those cows that are in late lactation, even on this really high-performing herd, have cell counts that indicate they may have one or more quarters infected. And this is a really common scenario on many farms. So when we look at trying to manage those subclinical infections, the treatment of them is usually best performed at dry off, not during the lactating time. And that's because we have increased efficacy of the antibiotics, we have reduced risk of drug residues because we're not milking the cow anymore, and it's more economical because we have no milk discard. Now, when we think about the preventive function, what we're trying to do is protect that udder from infection during this critical high-risk period when the cow dries off. And in the cow herself, the natural defense is this keratin plug. Now, this slide shows a teat cut in half across the teat sphincter, and you can see the inside of that teat canal is kind of spirally and thick, and it's got keratin within it. And that keratin is the primary defense against intramammary infection. However, in modern high-producing dairy cattle, some studies have shown that the formation of a keratin plug takes longer than it used to. And there's at least one study by Dingwell in 2003 that showed that 40% of cows still had open teats 2 weeks into the dry period, 30% still had open teats 4 weeks into the dry period, and almost a quarter of the cows still had open teats 6 weeks into the dry period. When they looked for risk factors on why those teats were open, they found that high production delayed formation of a keratin plug, and 50% of the cows that produced more than 46 pounds on the day of dry off had delayed formation of that plug. So our preventive function of dry cow therapy is really to protect the udder from development of intramammary infections during that critical early lactation period. Okay, to understand the use of a selective dry cow therapy, we have to think about what those programs are. The purpose of a selective dry cow therapy program is to use antibiotics only on cows that have evidence of current intramammary programs. So that's the therapeutic program. In a selective dry cow therapy program, we're going to use Teat sealants to prevent new infections. So in other words, we want to give antibiotics to cows that have evidence that they're infected. So we're going to still use antibiotics on infected cows, but we're not going to give antibiotics to perform the preventive function. To protect those cows, what we're going to do is use Teat sealants. So selective dry cow programs are not simply stopping use of dry cow therapy. They're selectively using dry cow therapy on cows that will most benefit from it. So there's been quite a bit of research around the world looking at use of selective dry cow therapy programs and the impact on udder health. And I've got several of the references that I've used to come up with this summary slide listed if you're interested in digging deeper into this information. But to summarize those studies, their research indicates that selective dry cow therapy, when just simply randomly applied to random herds and random cows, it does successfully decrease antibiotic usage, but it also increases mastitis. That tells us that it's not appropriate for every herd. The research also tells us that selective dry cow therapy, when carefully applied in selected herds, does result in decreased antibiotic usage without increasing mastitis. So selective dry cow therapies can be appropriately used in subherds. And we'll go into more details on that in the next few slides. But before we get into the implementation of a program, I really want to point out an important concept. And that is that there's no scientific evidence that's been published to date that shows that the use of blanket dry cow therapy is associated with increased antibiotic resistance. And likewise, there's no evidence to date that is documented that changing to a selective dry cow therapy program reduces the development of antibiotic resistance. So while it's a worthy goal to reduce unnecessary antibiotic usage, these things aren't necessary cause and effect. All right, so in thinking about the use of selective dry cow therapy in your own herd, there's a few aspects to consider before you'd even think about starting it. The first question that you have to address is, has your herd controlled subclinical mastitis? And to answer that question first, you'd want to review the bulk tank somatic cell count of your herd. Herds that have bulk tank cell counts greater than 250,000 cells per ml should continue to use blanket dry cow therapy program, because that's an indication that a large percentage of cows in your herd likely have subclinical mastitis. You'll also want to run a couple bulk tank cultures and ensure that your herd is free of Staph aureus and Streptococcus agalactiae. If you've got Streptococcus agalactiae in your bulk tank and Strep Ag in your bulk tank, you probably don't want to consider the use of a selective dry cow therapy program. You're probably getting benefit from using dry cow therapy in every quarter of every cow. And then finally, you want to think about, do you have the ability to adequately monitor mastitis? In other words, if something goes wrong, can you pick it up before you have a disaster? And to do that, you need monthly individual cow somatic cell count values, and you need to ensure that during milking, the operators are force stripping to identify clinical mastitis and also ensure that your clinical mastitis records are being accurately and consistently recorded. So if your herd is appropriate for using a selective dry cow program, the first question is, what methods should you use to identify cows that have active infections and will benefit from the use of antibiotics? Well, there's been a number of tests that are available and have been evaluated, but they basically come down to reviewing the history of the cow to see, has she had a history of previous cases of clinical mastitis, and what does her monthly somatic cell count history tell us? For example, this dairy comp file for the cow I'm showing on your screen, you can see that this cow, somatic cell count, has typically been indicative of a chronically infected cow. The cursor is on a cell count value of February 7th, 2015 of 1,900,000 cells. There was one month that was 140, but every other month indicates this cow has subclinical mastitis. That cow is not a candidate for selective dry cow therapy. So after we review the history of the cow, we can also look at considering the use of individual quarter tests to determine if a quarter will benefit from antibiotics. And the tests that have been evaluated have either been things like the California mastitis test or an individual somatic cell count test on a quarter, or the use of culturing milk that comes from specific quarters. Which test is best is a question I get most of the time from producers considering the use of selective dry cow therapy, and my answer simply is there's no one perfect test. All tests have error. So when you're considering the use of a selective dry cow therapy program, you have to think about which error means more to your herd. The two primary errors would be the failure to treat infected cows. In other words, you use a test such as culturing quarter milk, and you have a false negative. And for example, a high somatic cell count cow that's culture negative. That cow likely has an ongoing infection, but you've got a false negative culture result if she's got chronic high cell count. The other error you could have would be the treatment of cows that don't need that antibiotic. In other words, you're treating a healthy quarter. And this error is more common with non-culture-based selection, where you use just the cell count and history of the cow. A couple things to remember when you're trying to figure out which test to use. Cows that have increased somatic cell count month to month to month have evidence of ongoing infection. So if you use monthly somatic cell count history as your marker for who should be treated or not, you're going to maximize your treatments and minimize your failure to treat infected cows. If you use culturing, your false negative rate with culturing is going to be about 40%, and you're more likely to fail to treat infected quarters. So when you're considering which test to use, you might want to discuss which of these errors would be more important to you, and your local vet is a great source for a discussion on this topic. Okay, so which cows should be considered for selective dry cow therapy if you're within a herd that is eligible for it? So cows that have a monthly cell count greater than 150 cells per ml at the last monthly test, cows with a history of clinical mastitis within 90 days of dry off, these cows should receive antibiotic dry cow therapy in every quarter. So these cows should not receive sealants only. If you've got cows that have always had low monthly cell counts, no history of clinical mastitis within 90 days, and are otherwise healthy, those cows could be eligible simply to receive Teat sealants. And typically on herds that go into a selective dry cow therapy program, the reduction in antibiotic usage at dry off is about 50%. So somewhere around 50% of the cows will have low cell count, no history of clinical mastitis, and will be eligible to simply receive a Teat sealant. So cows eligible to receive only Teat sealant would have no history of clinical mastitis in the last 90 days, a cell count less than 200,000 cells per ml, and ideally you'd want to do a CMT test on all 4 quarters of the cows. Use a little bit higher threshold, CMT less than 2 on all 4 quarters. That means all the quarters are less than 300,000 cells per ml, and those cows would be eligible for Teat sealant only. Question then is, should you use an internal Teat sealant like Orbiseal or an external Teat sealant? And most research that's been done on the use of selective dry cow therapy has evaluated internal Teat sealants But there is a recent study that's used external sealants with good results. So I think more research is needed, and you'll need to stay tuned to see how this research works out. All right, here's our simple algorithm on trying to decide if a selective dry cow therapy program is effective for your herd. First, we start with the herd level criteria. If the bulk tank cell count is greater than 250,000 cells per ml, use antibiotic dry cow therapy in every quarter of every cow. If it's less than 250, then the next question is, do you have monthly cow somatic cell count tests and clinical mastitis records? If the answer to either of those questions is no, use antibiotic dry cow therapy in all quarters of every cow at dry off. However, if you meet both of those criteria, then you'll apply cow level criteria. If a cow has an individual somatic cell count greater than 200,000 cells per ml, or a case of clinical mastitis in the last 90 days of lactation, those cows should get antibiotic dry cow therapy in all quarters. The cows that don't meet those criteria, do your CMT. If all quarters are less than 2, those cows would receive internal teat sealant only. And the quarters, the cows with more than one or more quarters, CMT greater than 2, use antibiotic dry cow therapy in all quarters. Very simple algorithm to follow to help you make those decisions. Now, if you do go into using a selective dry cow therapy program, you need to think about what should you monitor. When you think about what should you monitor, you have to remember that dry cow therapy is only given to cows that are drying off. It's not given to primiparous cows. So if you see an increased cell count in early lactation or increased clinical mastitis in early lactation, the first thing you need to do is look at, is this just in the first lactation cows? Because if it is, it has nothing to do with your dry cow program. It indicates a problem with transition cow management. If you are using a selective dry cow therapy program, you want to monitor early udder health in your multiparous cows. And what we look at is the somatic cell count at the first test. And on a herd basis, 85% of the cows should have a cell count less than 200,000 at their first test. Second thing we can look at is the rate of clinical mastitis in the first month post-calving. And less than 5% of the cows should have a clinical case in that 30-day period. I do not recommend the use of culturing during the first week post-calving to evaluate a selective dry cow therapy program because many cows have a few coagulase negative staph that can be cultured from them out during that period, and those infections have a very high rate of spontaneous cure. Now, as I wrap up, I just want to go through a couple slides to look at the economics of this issue. And sometimes we have to remember and think about the cost of dry cow therapy programs. And I'm just going to do some examples using a 200 cow dairy. And I've just picked out a few of the drugs that are commonly used in dry cow therapy programs. These drugs are used as examples. They're not endorsements or disendorsements. So a few of the drugs that are typically used would be an internal teat sealant, Orbiseal, that typically runs around $10.50. SpectraMast DC I've included. It's a popular dry cow therapy program. It runs around $19. And tomorrow's another dry cow therapy, and I selected that because it's simply a different price than SpectraMast. If we have 200 lactating cows, remember not all of them are going to be dried off because some of them are going to be culled. They're not all going to conceive. So you've got about 170 of those cows that would be dried off. And I've done the economics on this with the assumption that selective dry cow therapy program reduces antibiotic usage by 50%. So in this chart that I'm showing on this slide, you can see the estimated annual cost of products used for dry cows. The chart for SpectraMast and for tomorrow, they each have 3 bars. The blue bar shows the cost of using just dry cow therapy, no internal teat sealant. For Orbiseal, it'd run just over $3,000, and for tomorrow, it would run just under $2,000. If you add an internal sealant, like many herds do, you increase your cost to about $5,000 for SpectraMast and to about $3,500 for tomorrow. And if you go to a selective dry cow therapy program, the thing to remember is you don't completely reduce your costs. What you're taking out is the use of antibiotics only. You're still typically giving the internal sealant, so the Orbiseal. So selective dry cow therapy program using SpectraMast and Orbiseal would run about $3,200 in a 200 cow dairy, and it would run about maybe $2,800 if you're using Tomorrow. You also have to consider what happens if the program doesn't work that well. So here I'm just going to walk you through the costs of mastitis control for a 200 cow dairy. And this slide shows you the baseline scenario. Now this is a herd that has excellent control of mastitis. They have a bulk tank somatic cell count of 195,000. Only 15% of the herd has an individual somatic cell count over 200,000 cells per ml. And their incidence rate is, of clinical mastitis is about 2% per month. The other values here, probably the only significant one is I've done this with the milk price of about $17.50 and a cull cow price of about $10.50. If those assumptions apply, you can see the total cost of mastitis control for this herd is about $82,000 per year, or $411 per cow per year, and 36% of that cost is preventive. The other costs are non-saleable milk when the cow has clinical mastitis, production losses due to subclinical mastitis, drug costs, culling costs, a little bit of death cost, and then our prevention costs. And the prevention cost isn't just dry cow therapy. This is your pre-dips, your post-dips, your vaccines, your bedding costs if you're using sand bedding. But the key thing to think about here and notice, it's $411 per cow per year. Now let's look at another scenario. This is the same 200 cow dairy. They've gone to a selective dry cow therapy program and it hasn't worked out so well for them. Instead of a 2% rate of clinical mastitis each month, they've got 3%. Instead of a bulk tank cell count of 193,000, it's 223,000. And instead of 15% of the herd over 200,000, it's 25% of the herd over 200,000. If that happens, you go from $411 per cow per year in total cost of mastitis, actually up to $436 per cow per year. And this is why. The top chart is our baseline scenario from the last slide. And what you'll see is your cost of your non-saleable milk goes up because you have more saleable mastitis. Your production loss goes up because you have more subclinical mastitis. Your drug cost goes up because you're treating more. Cull cost doesn't change. Death cost is minimal. But your mastitis prevention cost drops slightly from $148 per cow per year to $138. But that drop due to reduced dry cow therapy isn't enough to make up for all the losses if your program doesn't work out. And I show this because it emphasizes we gotta keep track of the cost of mastitis on our farms and have a good way to monitor the implementation of a selective dry cow therapy program. So let me just conclude. Our objective is to get to calving with a healthy cow that's able to produce high quality milk. The use of selective dry cow therapy can be effective in some herds, but you have to think about the risk versus gain, because if it's not well implemented, if it's not the right herd, you certainly don't want the costs of mastitis and the impact of mastitis on the cows to increase. When we think about selecting cows that need to receive therapy, the cows that would be eligible to receive the antibiotics, there's different tests we can use, but none of them are perfect. So you need to think about which error is more important on your herd. When you do decide to go to a selective therapy program, you should have good post-calving surveillance program to make sure you don't get into any problems, and if you do, to identify them early so you can change your management. And finally, always remember, while we want to work really hard to reduce the unnecessary use of antibiotics on farms, reducing dry cow therapy to prevent antimicrobial resistance simply is not a proven science. Thank you.